Now the next speaker is Dr. Narendra Singh VERMA, who is going to talk about…
Good afternoon, everyone. So my talk is SIA, a friend or foe for MSICS incision. So SIA is defined as the flattening effect in the axis induced by the incision, which is made on the cornea, and it will give some refractive outcome. So if we see the prevalence of corneal astigmatism in cataract patient, 97% are having less than 3 diopter, which can be totally corrected by MSICS incision, and 3% which are having more than 3 diopter, we can reduce some astigmatism in these cases. So if we compare, we will see how we can correct the astigmatism. There are two methods, one incision based and second is toric IOL. So toric IOL are costly, they are contraindicated in some cases. Incision based are economical, easy, safe. But the main problem is that predictability about the post-op outcome is lesser in the incision based estimate correction. So SIA is a friend if your incision size is customized and you have taken the incision on the steep axis. For the unplanned incision, it is a foe. So MSICS incision size ranges from 2 mm to 7 mm. Our aim is that we want to correct the post-op refraction. We want to keep it between less than 0.5 diopter. So 0.5 diopter over-corrected or under-corrected. So we are getting 1 diopter range of error. So I will show you a study in which in 80% of cases we achieve the post-op refraction less than 0.5 diopter. So to make SI as a friend for MSICS, we have to customize the incision size. For this, we have to calculate the flattening effect which is caused by the SIA, and we have to mark the steep axis properly at the perfect place. So for calculation of SIA, we have developed this SIA calculator. You can access by this QR code or by the URL. So this calculator is based on polar and vector method both. So those who want to do toric lens, there's in the upper part here this centroid SI is calculated same as by the Dr. Warren Hill method. Centroid SI, you can use this for toric calculator, and the lower part is the polar method. In this polar method, so this polar method measure the flattening effect. It measures 2 components. On the left side is the flattening part and right side is the steepening part. And there is only one input data sheet which is easy to use. You can select any combination, any size of incision, site of incision, so you need not to fill multiple data sheets in our calculator. This is the study done last year in the Medical College Thane. So they have used this high-end, this Topcon Aladdin topographer. And this is the study. They have done 102 cases. The patient who can't afford the toric lens, so they try to reduce the astigmatism by 3.5 mm main phaco incision and 3.5 mm OCCI. So you see that in 99% of cases, the cases are lying on the left side. They are lying on the left side, so there is flattening. Only in one case there was steepening. So this is the polar method. Here we will get the centroid SI value, which is indicating the flattening, how much flattening is there. In this case of 3.5 mm main incision and 3.5 mm OCCI, it was 1.28. So if we will take the range 0.5 diopter less than this and 0.5 diopter more than this, it lies between 0.78 to 1.78. So if we will draw these lines, so 80% of cases are lying in this. So what was the conclusion? We have seen that some people are saying in phaco, sometimes there is steepening, sometimes there is flattening. We can't predict the SI, how much will be there. So what conclusion we have drawn? That predictability of post-operative result in MSICS incision or larger incision is better if they are taken exactly on the steep axis and incision size is larger. So in this case of 3.5 mm, in 80% of cases, we got the post-operative correction between the range of 0.5 diopter. So this is our calculator. So you have this. This is also having toric current analyzer. This is MSICS nomogram, which we have made on the Dr. Buramani sir's some data. You enter the steep axis, flat keratometry and steep axis, and wide to wide, which is optional. It will give you the basic nomogram, how much chord length will correct, how much SIA, and how much will be remaining. This is SIA calculator data sheet. This is the input data sheet. So only through pre-op keratometry and post-op keratometry, you enter this, and you will get the result both by like Dr. Warren Hill, centroid SI for the toric lens, and the lower part is, this is the lower graph is for the flattening effect. So SI is a friend. If you are able to customize the incision size, you have to calculate SIA for your all incisions, and you have to mark the steep axis. You have to eliminate the error due to head tilt and cyclotorsion. You can use any type of marker, bubble marker, pendulum marker, some digital markers are also there, and now this real-time marking system is also there. So these are some apps which are available on the mobile, iToric app, and these are Toricam and Precision Toric apps. These different apps are there. So this manual marking method is 3-step method. In first step, we are measuring the amount of astigmatism. What is the amount of astigmatism? Then preoperatively, we are marking the reference marking. During intraoperatively, we are marking the steep axis. So if we are not doing reference marking, there will be the cyclotorsion error.